name is Kyle Kittleson. I'm a clinical psychologist here at the Counseling Center. One of my specialty areas is working with students with substance abuse and addiction issues. I run a group. I've been here about 3 years. I also teach in the counseling psych department, so some of the teaching that I do is around, I'll be actually teaching an addictions class this summer. So I also do a lot of training and supervision of students who are learning to be therapists and psychologists, so that's part of my role here. Let's see. So that's kind of my professional self. I moved here from Chicago a few years ago, so I'm getting adjusted to Indiana and being in a different environment, and starting to really enjoy a lot of the things that I'm learning about this area. So I don't know if there's anything else anybody can ask, so you can ask me too. So.
Okay.
All right.
So I was just wondering, what's the current theories about addiction, the newest knowledge that they have out there?
Okay. So there's a couple different ways of looking at addiction, I think. A lot of people will look at it through a medical model, like there's some neurobiological change that happens in your brain and that people are somehow predisposed or not predisposed. And there's a lot of really great research out there about that. I was just reading some new research about that too when it comes to they were comparing like the activated pieces of somebody's brain that is addicted to a substance and then somebody who's like addicted to pornography or the internet, and is that the same thing? And so the research is still being done, and some people are saying yes and some people are saying no, and so it's a really interesting kind of discussion that's going on right now. And so then what does define addiction? And so everybody has their different way. I think the medical model is one way to definitely look at it, and I think it seems to really work, especially when we're looking at substances that can work. Like there seems to be a physical, my body is saying I need this, and my mind is saying I need this, but I think there's a couple different processes that are happening, and that's kind of what the research is looking at. A lot of times I'll look at it from, more of what's happening for you. How do you feel about this? How is this affecting your life? And since I'm not a medical doctor, I am looking more at behavior, your emotions behind that. And so that's some of what the research is showing now. And a lot of times, some of the newer research, too, is talking about there used to be this kind of overall general theory that people were using drugs to feel good. But there's more of a theory coming around that addiction looks more like I'm using the drug or the substance or whatever it is to avoid negative feelings.
Okay.
So rather than gain positive, it's more of an avoidance thing. And so we'll often look at, and the newer research is researching more that on an emotional level and what the emotional expression is behind some of what's happening with addiction.
Okay. Do you think there's a big problem with people thinking that just using is the same as addiction?
Do I think that's a problem?
Yeah. Or do you think people get confused with that?
Yes, I do. I think people get confused with that, like, automatically if you're using this drug, and then also I think what happens, people try to put like a quantity on it. So if you use it this much, then that's addiction. But if you only use it this much, it's not addiction. And I disagree with that.
Yeah.
I feel like it's not about how much, it's about choice. And it's about whether or not you are still in control. If you feel like you have a choice about whether or not you use the substance, or if your body is saying you no longer, this doesn't feel like a choice anymore. It feels more like you're compelled, or your body actually needs it. With alcohol, it turns into our body actually needs it, and then it would be dangerous to stop. It would physically be dangerous to stop drinking if somebody's actually physically dependent on the substance. So I think it does get thrown around. And, they're using that, they're addicted to that. Well, yeah. They use it a lot. That's different to me. It's different than being addicted. And that I think a feeling of addiction can also have a negative implication on the person, like that they somehow are no longer in control of what they're doing, and they may feel perfectly in control of what they're doing. And so I always explore that with people. Like, how much control do you feel you have? And how much is this interfering with your life? And what is your experience rather than just some number of drinks or some number of, you know, blunts of marijuana or whatever it may be. Like, it's not about how many, it's about how is it affecting my life. So,
Do you think that part of it is in the definition of the word addiction, where now it just seems that people, and I do this too.
sure.
They'll say, "Oh, I'm just so addicted to this show," or "I'm so addicted to this."
Yeah, and I think, you know, I don't think that's necessarily a bad thing to say that. You know, we all kind of know what we mean, but I think it can take away from when people really are struggling with addiction, then what does that mean? And, you know, yeah, I think it can be problematic. I think we do that a lot with a lot of mental health concerns. People will say, "Oh, I'm cleaning the bathroom because of my OCD." Well, no, you're cleaning the bathroom because you like to have a clean bathroom. So I think like there can be some, and that can lessen, like it can feel different than when somebody actually is struggling. Like that's really painful. So when somebody really is struggling with an addiction, it's getting in the way of their life. It's so painful. And then if they feel like, well, everybody else is addicted to this and addicted to that, so what difference does it make? I'll just keep on going. So I think it can be problematic, but I also think, you know, I throw it around, oh, I can't wait to get home to watch like a show because I'm so addicted to it.
Yeah.
Not really addicted to it, but I think we've just put it into our regular vernacular rather than saving it for the professional community, and that's okay. It happens.
Yeah, it happens.
Yeah.
So when people do come to you and they have an addiction, what do you do to help them? What is the first step?
So I think I would say my first step is finding out, first of all, how much is it affecting their life? Like, what are the negative consequences of their experience that they want to change? And then where are they? I look at, like, how motivated and where are they? We have this kind of hierarchy. We look at stages of change. And where are they on that? And a lot of people are, excuse me, early on, they're kind of in this contemplation or pre-contemplation. I'm thinking about changing. This model was originally developed with people who were trying to quit smoking nicotine. So it's this idea that oftentimes people who are addicted to nicotine, which is highly addictive, like from a medical model, highly addictive. And so talking about the pre-contemplative of like thinking about like, well, yeah, I want to quit, but I'm not really ready and things like that. So I try to get an idea where the client is with that. Where are they? Are they ready to make some changes, or are they just kind of thinking about it? And it doesn't matter to me where we are, because we'll start wherever you are. And then we'll figure out, do we want to go the next step or do we not want to go the next step? That's all within their control. So, and I try to use some ideas of thinking about like, well, let's think about what it would be like to stay where you are and what would it be like to move to a different place. Like, and yeah, it's scary because I always think about that in my own life. Anytime, like I just said, like moving here from Chicago to Muncie, it's scary to make those big changes. So I just try to stay with them in that moment and think about what it would be like. And there's no judgment about whether or not they continue to use what they're using or stop using what they're using. I try to give them that power. So did that answer your question?
Oh yeah, absolutely.
Okay, good.
So what is your answer to people who come and say, why can't I stop this?
That's great, because that's a question that I get asked a lot. I sometimes, just kind of being kind of who I am, I'll say, well, do you want to stop? Like, let's start there. Like, maybe you don't want to stop. You know, maybe there's a part of you that does and there's a part of you that doesn't. So we'll just start with exploring it. Because I think it depends on what it is. Like, there's a lot of different things that people want to stop. And I'll even talk to them about, well, maybe you don't need to stop. Maybe we just need to figure out how does this fit into your life in a different way. So I work from a model of we don't have to always be abstinent from drugs or alcohol or whatever the thing is. Like, it could be internet. People will talk to me about that too. How does it fit into your life in a way that makes sense for you? So why can't I stop? Well, maybe you don't need to stop. maybe that's the answer too. So, and that's a lot of where I run my group. A lot of the people are not wanting to necessarily stop, but they're trying to figure out, maybe I need to stop. And so sometimes we'll get there. Like, well, I don't need to stop right now, but maybe I do need to stop. And it takes a while, kind of in that stages of change, it can take a while to realize, you know what, this alcohol or drugs, it doesn't fit in my life at all. But I don't start there. I start with, where are you?
Yeah.
Okay. Does that answer your question?
Yes.
Okay, good.
So why do you think it is that some addicts can stop and other people just, they're more susceptible to the addictions?
Yeah, that's a good question. I'm not really sure I have a good answer, though. I think it's just what we see in individual differences. I think, you know, there's theories out there that some people are more predisposed to being addicted to anything. And you'll often see people will stop one addiction and just change to another one. So oftentimes if you're at like an AA meeting where everybody has stopped alcohol, they may have moved on to something else, and often it's coffee and nicotine cigarettes often tends to be what's happening. And does that mean that they have an addictive personality? Maybe. Maybe it does, but maybe they're getting whatever benefit they got from the alcohol, and I think that's that sometimes can be the difference. I think people often look at it, the myth is that, oh, these people who can stop, they have better willpower. Mm-hmm. I don't buy that. I don't buy that at all. I think it's just difference, and maybe figuring out what it is that, what need is this meeting for me, and can I get that met in another way that feels more healthy for me? And I think that's the answer for a lot of people. Like, there's a need I'm getting met by this substance, whatever it is, and I don't like the consequences it has, but I like what it does for me. So how can I get the like part without all this bad stuff?
Yeah.
Yeah.
So do you think do you think it's just a combination of kind of genetics? Because there's been a lot of talk about genetics and your upbringing, because sometimes if you're just used to something in your culture, you know, I worked in prisons, so it's like you can kind of see that, you know, maybe they, you know, people say they didn't have a chance, and a lot of people say, oh, well, they did. Everybody has a choice, but not all the time.
I don't think, I agree. I think there's a genetic disposition, and I think there's also your environment. I think they're playing together like this, and tease them out is almost impossible because they're just too connected. So, I always try and look at a person's history and find out, like, what's your family? You know, if there's an addiction past in your family, the likelihood of you having an addiction is higher. It's not 1-to-1, but, you know, it's higher if there's addiction in the family, and if that's caused by genetics or learned behavior from the environment, or just the environment itself is lending towards this kind of behavior or this kind of use, I think that's important to know. But I also think, you know, and I think that's a big myth, like you said, that, oh, everybody has a choice. Well, some people have different resources to make those choices with. You know? I hate blaming people for where they are, because they are where they are, and that's okay. So do you think that this is part of the reason why some addicts can stop and others have a hard time maintaining? I would imagine there's probably a genetic component to that. There's maybe something going on medically. I think that there's all kinds of influences. I guess I tend to look at it more from my own worldview as a psychologist, and thinking about the needs and all of those things like I talked about. But I imagine that there's other pieces that are going on. And so often what we'll end up doing, I may see somebody early on in their use of drugs and things like that, and they may be just getting to that addicted point. And so I feel like I'm often one step along the way. And so people who can do it right here at this early step, it could mean a lot of different things. But if I can't figure out what it is that's keeping them from being able to stop, then maybe I can make a referral to somebody who's working at it from a different model. And so we'll do that oftentimes too. So I think each individual is different when it comes to why they can or cannot stop. But I think there's probably a genetic component to it, a behavioral component to it. a psychological, emotional component to it. So I think that all those things are happening.
So you think that some types, depending on the person, some types of interventions or treatments are more successful than others?
Oh yeah, absolutely. Yeah. I think what works for one person isn't going to work for somebody else. I really believe that. There's things that work better overall, and we can see that those benefit. And there's like you can cluster, like AA works because it works, right? So we've seen people come out of it on the other side, and it works. And what about it works? I'm not really sure, but also going into psychotherapy can work for people. Some people need like intensive outpatient stuff where they're going every day and seeing a therapist. Other people can come and see me once a week and it's working. So I think, yeah, you got to find what works for you. And I'm thinking a lot about alcohol, but also other things like nicotine. People often go into therapy looking to stop nicotine. And for some people, those nicotine replacement things work. For other people, it doesn't work. Mm-hmm. I think it all is dependent on an individual.
So, do you think that some addictions are worse than others? Do you think they're kind of...
That's a really interesting question, because I think worse in what way?
Well, it's, I guess, because there's health, there's, but then there's also some addictions in our society are kind of thought of as, well, that's okay. Alcohol is, watch Mad Men. That was okay back then. Right. Smoking was okay back then. And some people just don't think, they think of addictions as different. Some people don't think that sex addiction is really an addiction, that it's just an excuse. Same thing with food addiction. Yeah. So, do you think that, I guess, I'll rephrase the question and just that, do you think people think, your clients or people that you discuss with, your colleagues, think that certain addictions are worse than other addictions?
I imagine some people do. I think that there's like this social acceptance piece, I think is what you're talking about. Yeah. Like, so from a client's point of view, I think it may be harder than, depending. So it might be harder to explore, like, if this is socially acceptable, but it's a problem for me, then how do I talk to a therapist about it? Like, are they going to judge me? Or if it's like one of the ones that's not very socially acceptable, like somebody who's addicted to crack, maybe, that has like a really negative stigma with it, they may have a hard time coming into treatment because they don't want to be judged by the therapist. Yeah. So I think all of that is happening on a social level, and why those things are happening, I think, is just it's so intricate, and I think it has to do with, race, gender, social class, and all of those social factors that are influencing our thoughts about it. Because, like, one of the ones I think that we kind of right now are kind of like, it's an okay addiction is caffeine. Like, that's fine. If you're addicted to caffeine, that's not a thing. Like, from a health point of view, it depends on which day you read the paper, whether or not it's a big deal. Yeah. I happen to drink a lot of coffee, so I like the days when it says it's okay. But, I think, so from a health point of view, I think there's things that are worse and things that are not as bad. But I think from a social point of view, we put a judgment on things, and then we'll say, like with the sex addiction, oh, it's an excuse. Well, does it matter if it's really getting in the way of this person's life and their ability to form relationships? And if it's something that they feel is out of their control, who am I to say? Like, I can't say whether or not, how this feels for them. So all I can do is listen and figure it out. But I do think society has this, and I imagine, like, with sex addiction, society has a different thought about that when it comes to men and women. Like, and how they would look at that and what that would mean and what that would look like, and which would be positive and which would be negative, maybe. Yeah. So I think that, society, and I think that gets in the way a lot of times, and I talk about it with my clients, like, what does this mean, and how do you feel like your peers are looking at you, and who have you talked to about this, and what do they say, and how do they respond, and what does that mean, and even looking at how their cultural background might be affecting how they're thinking about it and how they're interpreting it and all of that as well, and what that might mean in their culture or in their family, for whatever that's worth. So I do think, like, we do that.
Oh,
but
yeah.
I know that that's inherent in the addiction. Like, I think we do a lot of stuff as society that just I question.
Yes. Well, and that's one of the things we're talking about in the class, I guess, kind of to wrap things up, is that we're talking about social issues and
Yeah.
we have addiction. But a lot of people think, addiction is an individual problem.
Oh,
But
yeah.
yeah, but it really is, it has larger social issues in many ways,
It
with,
does.
politically, with economically, with, with violence, all of
Mhm.
these different things. So I guess my final question to you would be, how would you answer someone, how would you respond to someone who says that addiction is not a social issue?
I would have to take a deep breath because to me it's so apparent that it's a social issue. Because, and I'll talk to people about this, like, oftentimes when I'll do an outreach program around alcohol or drug use, students will say, well, it doesn't have anything to do with me because I don't drink alcohol. I'm like, right, okay, but it still has something to do with you because people around you are drinking alcohol, and that's having an effect on you. And to say that any behavior that I engage in a social way is not having a social impact seems short-sighted in some ways. Like, so I think with addiction, I mean, we can start where a lot of people like to start, and that's with money. And what is the economic cost of this? And what is it costing? And I think a big social issue around some of addiction is, like, then what is it affecting with all of the arrests and all of that we're housing people in prisons regarding drugs? Like, and that has an addiction root. Like, somebody's feeding off of that, right?
Oh, yeah.
So the people that are the drug dealers are feeding off of the people who are addicted, and then we're keeping them in prisons and doing what? So, like, where's the treatment? Where's the help? Where's the stopping? And that's why it's a social issue, I think, because all of these things are happening. And just how does it lead to... Because one of the key factors of addiction is that people will go out of their way and spend an inordinate amount of time in order to obtain whatever substance it is. So that often results in, people trying to keep them from having the substance, and can result in them getting it in ways that they wouldn't normally engage in. So that can affect society. One of the things I'll talk about with students is just how does it affect your interpersonal relationships on a day-to-day basis? And so how does that affect, on a bigger level, society? So if there's troubles in different people's interpersonal relationships, that's going to affect, like, divorce rates and things like that. And I don't know that anybody would argue that divorce is not a social issue, or that marriage is not a social issue. And so all of these things are happening, and maybe it's happening on an individual level, but the ripples are going out, and they're affecting so many areas of our society. I don't know. This is such an interesting and wonderful question. Like, I could really talk about, like, all the different impacts it has on society. I think there's such a racial and social class and ethnic background issue with addiction, and the way that we treat it, and the way that we think about it, and the way that we make laws around it. And I think that just shows it's a social issue. If we're making laws around it, then how is it not, right? Like, so even if we're looking at nicotine, now we're making all these laws about who can smoke where and what we can do. So that's becoming a social issue. I think it's always been, but it's becoming more in the light. I don't know. There's so many ways, I think, that's how I would respond. I'd be just like, what are you not seeing here? And then kind of find, what? Yeah, it's an individual problem that has, like, social impact, I think, but one, yeah, it's so big. It is. It's a social and individual issue.
Okay. Well, I fib because I'm going to ask you one more question.
Okay, that's fine.
We're reading 4 different books about addiction, comic books. Okay. One is about kind of where we're putting it with sex addiction, and then the rest are on drugs. 2 of them are by Denny O'Neil, and he has Batman being addicted to a drug called Venom. And okay. Batman beats it on his own. He goes and locks himself in his basement or his Bat Cave, for 30 days. But then we're reading another one by Donny Cates, and he has superpowers, but he only gets them from drinking and drugs and things like that.
Sure.
And he's going to AA. So we have two different variations here. But would you encourage people to not try and handle this themselves like Batman?
I guess it would depend on the person, but it would be a rare person, I think, that would be able to do that. But I also, in saying that, I believe that's true for any huge struggle that we face in our life, that we need other people to support us. Whether that person has to be a professional or not, I don't know. But I feel like we need support. And it would be the rare person who locking themselves in their room would be the answer. But I'm sure they're out there. So I will never say nobody. But I guess my recommendation is, how do you use support in your life? And where can you find some in this? And what do you need? And maybe you can lock yourself in the room as long as you have somebody you can call on the phone. And that's what you need is support. But I do feel like we all need each other in some way. And I believe that. So I think my worldview sort of taints my answer a little bit in some ways. But I do think, even from a professional, just if I try to look at it very clinically, like, it would be a rare person who would be able to do that on their own, but I'm not saying they wouldn't be out there. I often hear from clients, well, I just need to do this. I just need to tough it out. And I'll say, okay. And then they'll try it and it doesn't work. And then we can talk about that. But I think that toughing it out, it can only work for so long, and for most people. Otherwise, we always feel like we're just toughing it out all the time. And that doesn't really feel good, that it's this constant struggle. So I think support is so important. And whether that's me or, anybody, or your dog, your pet, anybody, somebody. So.
That's awesome.
I wouldn't recommend the Batman way, although I am a big fan of Batman. So.
Yeah. Yeah, well, he's kind of a unique individual.
Yes.
So, and, not everyone has a bat cave. So.
Exactly. I mean, if I had a bat cave, maybe I would think about it differently.
Yeah, and he had Alfred, his butler, upstairs, just in case.
Yeah.
So he did have somebody. So.
Yeah, so Alfred's always kind of there, right? Like, whether man really knows it or not.
Exactly. He's always there. He's taking care of him.